If you receive Medicaid health insurance through your state and you're turning 65, don't assume things are going to stay the same. Hi, I'm Larry Goist, owner of LMS Insurance Group, where we help seniors navigate the Medicare maze. So in today's short video, I'm telling you guys how Medicaid works with Medicare. And specifically, I'm going to be talking about three basic topics. So number one is, what exactly is Medicaid? Number two is, what changes when you turn 65? And then number three, I'm going to tell you what you need to do to make sure you are still entitled to all of your benefits. And that's all coming up next. Okay, so let me preface this video by saying Medicaid rules are not the same in every state. So I'm not going to try to do like a blanket video of all states and how this works. I'm talking specifically about what happens in Ohio when you have Medicaid and Medicare. So what is Medicaid? Well, Medicaid, simply said, it is health insurance for low-income individuals. Free health insurance. So in Ohio, to be eligible to receive Medicaid, if you are between the ages of 19 and 64, you just have to be at or below 133% of the federal poverty level. So to be at or below 133% of the federal poverty level, that just means that if you're single, you have to make less than $1,670 a month. So imagine you're working a job and you make $1,600 a month. Well, if that's the case, you would qualify for Medicaid. It's that simple. You see, in Ohio, it doesn't matter if you are looking for work. It doesn't matter how much money you have in the bank. It doesn't matter how many homes you own. If you make less than $1,670 a month, you qualify for free health insurance, aka Medicaid, in the state of Ohio. Now, to apply for this assistance, you go through your local assistance office, which in Ohio, we call that Job and Family Services. So you go to your county's Job and Family Services, and you simply apply. If you're below 133% federal poverty level, you get Medicaid, and now you have free health insurance. You have no copay at the doctor, no copay at the hospital, no copay for prescription drugs. You could be unemployed, you could be working, you could be looking for work or not looking for work. If you make less than $1,670, you would qualify for Medicaid in the state of Ohio. But what changes when you are Medicare eligible? So, Medicare is health insurance for people 65 and older, and also people with disabilities. So imagine you're 64 and you're making $1,500 a month. You might be on Social Security and you are approaching your 65th birthday. So you had Medicaid because you were under 133% of the federal poverty level. You had free health insurance. Now you're turning 65 and you're Medicare eligible, but the rules all change. So when you are Medicare eligible to still receive Medicaid assistance, now you have to be at or below 100% of the federal poverty level if you want all your copays and coinsurance to be paid for you. So to keep free health care, no copays at the doctor, no copays at the hospital, you have to qualify for what's called the Medicare Savings Program. And there is a part of this program called QMB, which stands for Qualified Medicare Beneficiary. If you qualify for QMB, now the state pays your Medicare premium, your Medicare copays, and your Medicare coinsurance. And that would be the most similar thing to what you had when you were 64. You had a plan with no out-of-pocket costs. But you can no longer make 133% of the federal poverty level, right? You would no longer qualify. You'd have to be at 100% or under. And what that breaks down to is $1,255 a month. So now you're turning 65. That person that was making $1,500 a month would no longer qualify for free health insurance. They would now be subject to copays and coinsurance when they're on Medicare. The second thing that changes is that now that you're Medicare eligible, your resources matter. I said earlier in the video, I know millionaires, people that have $1 million homes that have Medicaid, right? And they might have several homes. That is no longer the case once you're on Medicare. You see, once you're on Medicare, if you still want to receive this assistance through the Medicare Savings Program, you have to be limited in resources. So your resources, if you're single, have to be under $9,430. And resources are any money you can get your hands on. So if you have more than $9,430 accumulated between your checking account, your savings account, stocks, bonds, IRAs, annuities, 401ks, you would no longer qualify for Medicaid assistance. Where when you were 64, you could have had $1 million in the bank and gotten free medical. Now that you're 65, you have to be limited in resources as well if you still want to qualify for this Medicaid assistance. So what should you do if you receive Medicaid and now you are Medicare eligible? Well, the first thing you want to do is you want to call your local Job and Family Services office and you want to apply for the Medicare Savings Program. See, it's not just automatic that they're going to give you this assistance because now you have to prove that you are under the resource limit. So about a month before you're eligible for Medicare, you call your local Job and Family Services and say you want to apply for the Premium Assistance on Medicare, otherwise known as MPAP. When you do this, you call in, you're going to get a caseworker on the phone. They're going to say, okay, that's great, but now we need to send you out a checklist because you have to verify that you don't have more resources than that level that I mentioned before. So they're going to send you out a verification list. They're going to want copies of your checking account, savings account, and any proof of assets. And the one thing that goes unnoticed a lot of time is that every vehicle you own beyond one is considered a resource. So you can have one vehicle and you could own one home, but everything beyond that is considered a resource. So when you were 64, you could have had 3 homes in your name. It wouldn't have mattered. Now that you're Medicare eligible in 65, if you have 2 homes in your name, you're not going to qualify anymore. They don't count the first house, but your second house would be a resource and certainly would put you over that $9,000 resource limit. So again, about a month before you're Medicare eligible, you want to call into the assistance office, apply for the Medicare Savings Program, which they know as the MPAP program. Now, these numbers, these programs change all the time. So what are you supposed to do? Well, that's what we're here for at LMS Insurance Group. Look, this video is specific to Ohioans because the rules are different in every state. But we are a multi-state independent insurance brokerage. If you want to learn the rules in your state about premium assistance, Medicaid, and Medicare, use the information in the description below as me or another Medicare expert in my office would love to help you navigate the Medicare maze. But the first thing you should know is just don't assume things are going to continue as normal when you're Medicare eligible because there is a different income limit and there is a different resource limit once you do get that red, white, and blue Medicare card. Guys, thanks so much for watching. I hope this was helpful. I'll talk to you next time. Larry Goist, LMS Insurance Group.